All right, so we've got a mountain of medical textbook excerpts here, all about breathing emergencies. You know, those moments when something goes wrong and suddenly taking a breath becomes a struggle.
Exactly. And our mission today is to give you that EMT's eye view to really understand not just what's happening, but why when someone's gasping for air.
So imagine this. You're an EMT, sirens are blaring, you're racing to a scene, and it could be anything. A panicked kid, maybe, or a grandparent who's collapsed. What are those first things that pop into your head?
Scene safety, always.
Yeah.
Got to make sure we're not about to become part of the problem. But right after that, it's straight to the ABCs. Airway, breathing, circulation, the essentials.
It's like a rapid triage for the human machine.
Exactly. And these sources really drove home how EMTs have to be prepared for anything.
Talk about pressure. So when we're talking about breathing, we're obviously talking about the lungs, but it sounds like it's way more complex than just that.
Oh, absolutely. We're talking about the diaphragm, those chest muscles, the nerves controlling everything, even those tiny air sacs alveoli. All these things have to work together seamlessly.
Okay, so way more intricate than I realized. Give me an aha moment about how this whole breathing process actually works, something most people wouldn't know.
You know, most people don't realize it's all about pressure. Think of it like this. Your lungs are like two balloons in your chest.
Okay, I kind of see where you're going with this.
When you inhale, your diaphragm and chest muscles create negative pressure. And just like a balloon, your lungs inflate. But here's the kicker. Your brain is actually monitoring the CO2 levels in your blood to control this whole thing.
So too much CO2, and your brain basically says breathe faster.
You got it. See, when CO2 dissolves in our blood, it creates carbonic acid. Too much of that, and our blood's pH gets out of whack, and the body needs things to be just right. So more CO2 means faster breathing to flush it out, restore that balance.
Wow, that's pretty wild. This intricate system working constantly to keep us alive. But when things go wrong, that's where those respiratory emergencies come in, right? And these sources listed so many things that can disrupt this system. Infections, lung collapses, even blood clots. It's a lot to unpack.
It is, but like a good EMT, we'll take it one step at a time. Let's start with those emergencies that are, thankfully, often more scary than life-threatening. Think about those little ones. Ever hear that barking cough, the one that sends parents into a frenzy?
Croup. It's like every new parent's nightmare. But it's more than just a cough, right?
Right. It's inflammation in the trachea, the windpipe, which is much narrower in young kids. And that's where that humidified oxygen comes in.
Because moist air helps soothe those inflamed airways.
Exactly. Now, on the other end of the spectrum, when we're talking about adults, one condition that always comes to mind is a pulmonary embolism.
And that's where a blood clot, often from the legs, travels to the lungs, creating a blockage.
Exactly, and it can be incredibly dangerous.
Mhm.
Part of the challenge is that the symptoms can be easy to brush off. Sudden chest pain, a rapid heartbeat, maybe even coughing up blood.
Okay, coughing up blood definitely gets your attention. I think I'm starting to see why a deep understanding of this whole system is so important. These sources also kept mentioning adventitious breath sounds. Is that just medical jargon for bad?
Well, essentially, yes. Adventitious breath sounds are those abnormal sounds that shouldn't be there. Instead of the normal whoosh of air, you might hear wheezing, that high-pitched whistling.
Usually a sign of narrowed airways like with asthma.
Precisely. Or you might hear crackling.
Crackling, like crumpled paper. What's that telling us?
That one can send chills down an EMT's spine. It often means there's fluid in the lungs, which could point to heart failure. Pneumonia definitely cause for concern. And then there's carbon monoxide, the silent killer.
Odorless, colorless, mimicking the flu in the early stages. These excerpts really drove home why knowing the context of a breathing problem is so crucial.
Absolutely. It's not just about recognizing the symptoms, but understanding what might have caused them.
So our EMT arrives on the scene. What can they actually do besides driving someone to the hospital?
Oh, they're far from just ambulance drivers. They're trained to assess, administer oxygen, even help with certain medications. They might use an inhaler for an asthma attack, or even a CPAP machine in some cases.
Wow, I didn't realize how hands-on it could be. I also kept seeing this phrase, pertinent negatives. It sounds very Sherlock Holmes.
It's a bit like that being a detective in reverse. Let's say someone has chest pains, but they're not short of breath. That's a pertinent negative, a clue that maybe the root cause isn't primarily in the lungs.
Fascinating. Any other tricks of the trade that would surprise us non-medical folks?
Even just the questions EMTs ask can be so telling. They might ask, how many words can you say before you absolutely have to take a breath? It gives them a sense of how much trouble you're in.
I never would have thought of that. This is all so eye-opening.
It is, and we've only just scratched the surface here. but it really highlights how much goes into understanding breathing or when it goes wrong.
You know, going through these textbook excerpts, it's amazing how much emphasis is placed on that initial patient assessment. It's like piecing together a puzzle, right?
It's absolutely crucial. Like, even something as basic as the patient's position can be so revealing. Are they sitting upright, struggling to breathe, or are they lying down, barely conscious? Every detail adds to the picture.
And then there's that quick assessment of responsiveness. The AVPU scale, are they alert, responding to voice, only to pain, or unresponsive?
Exactly. It gives you an immediate sense of how much oxygen is actually reaching the brain.
Obviously, asking about their chief complaint is key. What are they feeling? When did it start? But what if they can't even speak? Maybe they're unconscious or just too distressed.
That's when bystanders, family members, they become invaluable. They can often fill in those crucial gaps, pre-existing conditions, allergies, medications, the stuff EMTs need to know.
Right, that sample history, signs and symptoms, allergies, medications, past medical history, last oral intake, events leading up to the incident. It's like a roadmap.
And, just as important as the symptoms that are present are those that aren't. Remember those pertinent negatives we talked about?
Yeah.
Sometimes what's missing tells just as much of a story.
I love that analogy of being a detective.
Uh,
Okay, so let's get specific. How does an EMT actually assess someone's breathing? What are they looking for, listening for?
Well, first and foremost, they're making sure the airway is open and clear. It's absolutely fundamental. And then it's about evaluating the breathing itself. The rate, the rhythm, the quality. Are they breathing too fast, too slow? Is there a pattern? Are those breaths shallow, deep, labored?
It's amazing how much you can glean just from observation. And then there are the actual sounds, right? These excerpts went into all those terms, wheezing, crackling, ronky. It's like a whole other language.
And each sound tells a story. Wheezing often means narrowed airways, like we see in asthma. Crackling can indicate fluid buildup in the lungs. Raunchy, those rattling sounds, often mean there's mucus in the larger airways, like with bronchitis or pneumonia.
It's incredible how much those sounds reveal. There's also stridor, that high-pitched sound on inspiration.
Ah, yes. That one usually means there's an obstruction in the upper airway. Very serious, demands immediate attention.
So EMTs are looking, listening, asking questions, building this whole case file in real time. But it's not just about breathing, is it? There's that C in our ABC's circulation.
Right, the human machine needs all its parts working. The sources talk about how EMTs look at skin color too pale, too blue even temperature to assess circulation.
Because pale, clammy skin can indicate shock, and bluish lips and fingertips, that means there's not enough oxygen in the blood.
Exactly. And it's all interconnected. Breathing problems can impact circulation very quickly and vice versa.
It's a lot to consider. No wonder those EMTs always seem so calm and collected under pressure. They have a lot to process in those critical moments.
They absolutely do. And we haven't even touched on the many different respiratory emergencies they encounter. That's what makes this whole deep dive so fascinating. Each condition has its own unique challenges, requiring a tailored approach.
Which brings us to those specific conditions. We've touched on croup, pulmonary embolisms, but these sources mention a whole range of others. Shall we explore some of those in more detail?
Absolutely. Let's start with a condition that's often misunderstood, even by those who have it: asthma.
Asthma, that's the one where the airways constrict, making it hard to breathe right. Lots of wheezing involved.
Exactly. It's an inflammatory condition affecting the airways, and the severity can vary wildly. That wheezing happens when air is forced through those narrowed airways.
And the triggers are all over the map, aren't they? Everything from allergies to exercise, even stress can set it off.
Absolutely. Triggers are highly individual, which is why if you do have asthma, understanding your triggers is so important.
So let's say someone's having an asthma attack. What can an EMT do in that situation?
Well, oxygen is usually the first line of defense. And if the patient has a prescribed inhaler, the EMT can assist them in using it.
Inhalers, those little devices that deliver medication directly to the lungs. The excerpts mention all kinds of different inhaler medications.
You've got your short-acting bronchodilators, which provide quick relief by relaxing the airways, and long-acting ones used for prevention. There are also corticosteroids, which help reduce inflammation in the airways.
It's like a whole pharmacy in your pocket. They also mention nebulizers. What are those exactly?
Think of it as a more powerful way to deliver medication, especially for severe attacks, or for those who struggle to use inhalers. A nebulizer turns liquid medication into a fine mist that's inhaled.
It sounds like there's a lot EMTs can do to help. But what if the attack is really severe and those initial treatments aren't working?
That's when things can get really serious really fast. A prolonged, unrelieved asthma attack can actually progress to status asthmaticus, which is a life-threatening medical emergency.
Status asthmaticus that has a serious ring to it. What are the signs that an attack is escalating to that level? What should people be aware of?
You'll see extreme difficulty breathing, even with oxygen and medication. They might be using every muscle in their chest and neck just to try to breathe, and often they're utterly exhausted, extremely anxious.
That sounds terrifying. I imagine getting to the hospital quickly is critical in that situation.
Absolutely. Status asthmaticus requires advanced medical care. Speaking of serious, let's talk about another condition that can deteriorate very quickly: pulmonary edema.
Pulmonary edema, that's the one where fluid builds up in the lungs, right? The sources described it as essentially drowning in your own fluids, which is a pretty chilling thought.
It's a very serious condition, often stemming from heart failure. When the heart can't pump blood effectively, fluid can back up into the lungs, making breathing incredibly difficult.
So what are some of those red flags that signal pulmonary edema? What should we be looking out for?
Extreme shortness of breath, often with a rapid, shallow breathing pattern, is a key sign. They might also have a cough, and in severe cases, they might even cough up frothy, pink-tinged sputum.
Frothy, pink sputum. Okay, that's definitely a sign that something is seriously wrong. So how do EMTs approach treating pulmonary edema on scene?
Oxygen is paramount, as always. But with pulmonary edema, they might also use a CPAP machine to help force air into the lungs and push some of that fluid back into the bloodstream.
CPAP, that's continuous positive airway pressure, right? Like what people use for sleep apnea.
That's the one. It's a non-invasive way to support breathing and can be incredibly effective in these situations. But again, getting them to the hospital for further treatment is absolutely essential.
It seems like with so many of these respiratory emergencies, time is really of the essence.
You're absolutely right. Early recognition and treatment are paramount. That's why having even a basic understanding of these signs and symptoms, even for those of us who aren't medical professionals, is so valuable.
It's about being your own health advocate. If something feels off with your breathing, don't ignore it. Knowing what to look for could quite literally be life-saving.
Couldn't agree more. We've covered a lot of ground here, but there's still more to uncover in this fascinating world of respiratory emergencies. What shall we dive into next?
We've talked about asthma, pulmonary edema, some pretty serious stuff. But I know the source material also mentioned COPD, chronic obstructive pulmonary disease. What exactly falls under that umbrella?
So COPD, it's not just one thing. It's a group of lung diseases that over time make breathing harder and harder. And, more often than not, it develops after prolonged exposure to irritants.
These sources really hammered home that link between smoking and COPD, didn't they?
It's impossible to overstate the damage smoking does to your lungs. It's the primary cause of COPD, and it just slowly but surely makes breathing a daily struggle.
So you're an EMT, you encounter someone who might have COPD, and they're in distress. What are those telltale signs you're looking for?
Shortness of breath, especially with any kind of exertion, that's a big one. They might have a persistent cough, often bringing up phlegm, and wheezing, particularly when they exhale.
I remember the source material mentioned something called a barrel chest. It sounds kind of comical, but I'm guessing it's anything but.
You're right, it's not a laughing matter. Barrel chest, it's a classic sign of long-standing COPD. Basically, because airflow is so compromised, air gets trapped in the lungs, causing the chest to overinflate, taking on that rounded shape.
Okay, so an EMT arrives on the scene, potential COPD, patients in distress. What happens next? What's the course of action?
Oxygen, like with so many respiratory emergencies, that's key. They'll also likely help the patient use their prescribed inhalers if they have them, try to open up those airways.
What about CPAP? We talked about it being used for pulmonary edema. I wonder if it has a place in treating COPD as well.
It can, absolutely. CPAP can be a lifesaver for COPD patients, especially during a flare-up. But again, getting them to the hospital for proper medical care is the ultimate goal.
So we've got asthma, pulmonary edema, COPD, all very serious conditions. But what about something like hyperventilation? Is that even something EMTs would consider a true respiratory emergency?
It can be, absolutely.
Yeah.
Hyperventilation, it's that rapid, deep breathing, right? And it throws off the body's CO2 balance.
I always thought of it as purely anxiety-driven, like during a panic attack. But these sources, they mention things like diabetic ketoacidosis, even aspirin overdose as potential causes. It suddenly seems a lot more serious.
It's not something to be taken lightly, that's for sure. And that's why for EMTs, it's about looking beyond the obvious, considering all the possibilities. Dismissing it as just a panic attack could have really serious consequences.
So someone's hyperventilating, EMT's on the scene. What can they actually do?
First and foremost, they're going to work to calm and reassure the patient.
Yeah.
Sometimes that's enough to break that cycle, but they're also checking for any signs of a more serious underlying issue, and they might administer oxygen if needed.
One thing that stuck with me was the emphasis on not having the patient breathe into a paper bag. I always thought that was standard advice.
Yeah, that's a common misconception. Rebreathing exhaled air can raise CO2 levels, which is what you need in a hyperventilation situation. But it can also be risky, especially if there's an undiagnosed medical condition at play. Better to leave that kind of intervention to the pros.
Makes sense. Well, we've covered a lot of ground here. The mechanics of breathing, how EMTs assess those in respiratory distress, all those specific emergencies. What are some of the big takeaways you hope our listeners are walking away with?
I think the biggest one is just how quickly breathing problems can escalate. You can't ignore them.
Yeah.
And knowing the signs, both in yourself and in others, that's powerful. It could be the difference between a minor incident and a full-blown crisis.
Absolutely. Never, ever hesitate to seek medical attention if something feels off. Better safe than sorry when it comes to something as vital as breathing.
100%. Early recognition and treatment, those are the keys.
Well, I think it's safe to say that our listeners now have a solid foundation in breathing trouble. They're practically junior EMTs at this point.
Armed with knowledge and ready for whatever comes their way. But remember, this is just the beginning. The world of respiration is huge and endlessly fascinating. So much more to explore.
And that's the beauty of a deep dive, isn't it? It sparks that curiosity, encourages us to keep learning. So we'll leave our listeners with this. Think about your own health history, maybe a family history of lung issues, allergies that affect your breathing. What's one thing after today's deep dive that you can be more mindful of? Thanks for joining us, and remember, breathe deep, breathe well.